So next we're going to look at our median nerve proximally, where we would do a proximal median nerve block. To try and localize this, you can look into the antecubital fossa and place your probe where you expect to find the brachial artery, and then the median nerve should be just medial to that, which we can see here. If you're having trouble locating that, the other option is to go from distal to proximal, where you can be sure that you're following it the whole way. So that would be coming down near the wrist in the carpal tunnel, and then following the nerve proximally. Just try and angle it so you can see it better there. And it dives deep, deep, and then comes back up more superficially. I'll come back down distally just so we can try and get a better view of that. Again, it's sort of hard to follow in that region depending on your angles, but now we can see it again coming up medial to the brachial artery. So this is right around just proximal to our antecubital fossa. You can see the muscles here we're looking at on the left, or the medial aspect, is the beginning of pronator teres. Underneath the median nerve is the brachialis muscle. And so if we go more proximal till we don't see pronator teres, now we are above the elbow, and I'll angle my probe so you can see the nerve a little better. We still have our brachial artery, but now we're primarily over brachialis. And then we have a superficial vessel, a vein here, which you can see I'm compressing, so you'd want to be mindful of that. If you're trying to block all of the muscles of the median nerve, including pronator teres, you would ideally be above the start of pronator in this location. And we're approximately, I would say, 3 finger breadths up from the medial epicondyle. When you look at this view, you wouldn't really want to come lateral to medial because the brachial artery is in the way. You could try to get around that coming superficially. The other option is to come medial to lateral, but if you look at the position on the bed, if we put on the Doppler, you can see it better. That might be a vein. Now the median nerve is kind of sandwiched in between a few blood vessels. To access the median nerve from a medial to lateral, then we would want to come in this direction, but you can see that we're very close to the bed. So ideally you'd want the patient in a slightly more abducted and externally rotated position. Or if we go slightly more proximal, you might be able to come in lateral to medial here, where the brachial artery is a little bit more inferior than the median nerve. But I'll show you the positioning of abduction and external rotation. And then we can find our brachial artery once again. And then moving proximally, you can see our median nerve coming in nicely here. And we can't see our pronator teres. So this could be a good location to do our injection, coming medial to lateral. And I'll show you what that would look like. So we would come in this position close to our probe, again in plane. And then we can slide each side to make sure we're not near anything from a neurovascular perspective. Bring our ulnar nerve closer to our median nerve closer to the edge, and then again in plane injection here. As we go more distally, our pronator teres starts to come into view. However, if you look at the view here, this has a better approach for injections because we'd be going primarily intramuscularly. So if you wanted to still do a median nerve block but not include pronator teres, this would be another location where you could come medial to lateral through the bulk of pronator teres to access that median nerve. And it's been separated slightly from the brachial artery at this point as well.